right. Welcome to the Chaska Human Rights Commission meeting on March 22nd. We will start with the roll call. Nate?
Yes. Chairperson Welvert.
Here.
And we got Vice Chair, I'm sorry, who did we name Vice Chair at the last?
Dunbar.
Dunbar, yes.
Here.
All right. Robert Kim.
Here.
Donzel Leggett.
I'm here.
Jeff Philippek.
Here.
Kaylee Haga.
Here.
And Lisa White.
Here.
And Sarah Carlson is also absent.
Okay. Well, we got the agenda earlier this week, and everyone had a chance to look at it, I hope. So do we need time to look at it, or can we?
Do that first, or are they doing?
Yeah.
I think you have minutes, I'm sorry.
That's okay. So first, if everybody's had a chance to look at the agenda, then we can have a motion to adopt it.
So moved.
Second. All in favor?
Aye.
Okay, the agenda is adopted. And the next thing on the agenda is that we're going to have a guest presentation tonight, and Robert is going to do a little introduction for that.
Yeah, I'll just do a quick introduction. I've asked the Metro Agency on Aging to join us today, as their work is of critical importance, I believe. But just as importantly, I feel that we can take action on this issue, and there is a potential to partner with this group as well as other community-based groups regarding this issue in our community. And that will be a community-wide engagement. There's a chance and opportunity for us to make a positive impact. The presentation today is being conducted by the Metropolitan Area Agency on Aging, Executive Director Don Simonson, and also from ACT on Alzheimer's, Executive Lead Emily Sarah Miller. So thank you for joining us. And I should also note that the President and Board Chair of the Metro Area on Aging is Carver County Commissioner Randy Maluchnik, who initiated this contact with us in the past January at the MLK breakfast, so you should be acknowledged as well. So with that, welcome, Don and Emily.
Thank you. We so appreciate being here today and glad that Commissioner Maluchnik made the connection. So I'm going to start off, and then my colleague Emily will join me. And we're really here to talk about a movement, really an initiative that Metro Area Agency on Aging has been involved in since 2011. And the Area Agency on Aging is just one partner in what has become a very significant initiative around Minnesota to help us prepare for the growing number of people who are living in the community with dementia. Now, this is well aligned with MAAA's mission. We're all about helping older adults live in the community as they age and supporting their family caregivers. And we know that Alzheimer's is a disease that it's an organic brain disease that strikes 1 in 9 people age 65 and older, and 1 in 3 age 85 and older. So I'm guessing that you either know someone who has Alzheimer's or another dementia, either in your family or your faith community or in another way. And my sense is that for you, just as for me, that this issue will hit close to home, as they say. So I'm going to do the easy part here, and then Emily will do the more interesting part, and I'll just talk a little bit about the initiative. So this really sprang forward in 2011 from a legislative study that made a number of recommendations, and a collaboration formed to implement those recommendations. And for us, thank you to work on getting Minnesota prepared as our growing population of older adults comes forward. And the coalition was originally called Prepare Minnesota for Alzheimer's, and it was really looking out about 20 years, and then it became really clear that we could get some work done much more quickly, and we took on an action-oriented title, and we became ACT on Alzheimer's. And the coalition was very broad. social service organizations, state agencies, healthcare providers, health plans, foundations, and many other interested organizations and communities. So in some ways, Act on Alzheimer's has come full circle relative to the legislative process. There was legislation last year to do a revisit of the study to see the progress that Minnesota has made, and there's currently another study group. And so I just want to call your attention to the Alzheimer's Disease Working Group. If you want to get involved or follow that work, the link is there for you. Now, MAAA's role, we're a private nonprofit organization. Thank you. Obviously need some help. MAAA's role in this is that we've been the fiscal organization, so the funding that's come from individuals and foundations and some from government has come through our agency. That's a common role for us. We're an intermediary. But we've also been a leader in helping to build the tools to help communities become dementia-friendly and make certain that they're disseminated all throughout Minnesota. So when ACT first came together, it had 5 really big goals, and it was about reducing cost related to care, and that was specifically nursing home care, increasing detection of Alzheimer's disease. Most people don't get a diagnosis, and if you don't get a diagnosis, you can't plan, right? And you can't make the best of your ability to live in the community and to live well. We knew we wanted to equip communities to become dementia-friendly, and we also wanted to work with healthcare systems. If people don't get a diagnosis, they can't receive support and treatment from their healthcare system, much less from community systems. And so all of this requires that we were able to reduce stigma. Alzheimer's and dementia has tremendous stigma, and raise awareness. All right, now I'm going to remember to go to the next slide. So that early work between 2011 and 2015 was all about building our approaches, building tools, building the collaboration. As one of our activists in the movement, should we say, talks about it, we really built the foundation for the house. And then as 2015, 2016, 2017 came forward, that was really when we began to grow the work and focus the work on practice change in the healthcare environment, and then work to help communities get interested in this issue, form action groups, and take on work in their community to make them supportive of older adults and their families living with dementia, really working to build bridges and bridges into the community to help people stay engaged and healthy and live well with the disease. So this very large coalition was never intended to be a nonprofit organization. It's not a separate organization. It's owned by everyone who's participated in it. But the secret sauce has been a really strong backbone. And Emily's been one of the leads in providing just the glue that holds this work together. Currently, the work is nesting in organizations that are taking on specific approaches. The area agencies on aging in Minnesota, the 7, and then Stratus Health taking on the work of the provider practice change with some support from a group of physicians and healthcare organizations. All right, so that's the history. Now here we are in 2018, right? And this is likely what you're most interested in. So we've come to find that Act on Alzheimer's really can go forward with the kind of a framework and structure that really relies on these nesting organizations who will carry the work forward. At one time, Act on Alzheimer's, to do this work, raised a significant amount of resources. Those resources went into building the tools, the practices, the change in thinking. But we're at the point now where those tools are available to communities across Minnesota, and we currently have 65 communities that have engaged in this work, and very few have fallen off. I think maybe 7 of the communities that have engaged in this work we would consider inactive now. So as we go forward, we have a framework in place, we have a structure in place, and we have tremendous tools and interest and a whole network of collaborators across the state. So I'm going to focus for just a few minutes on the healthcare practice change work, and if you are engaged at all as a volunteer in a healthcare system, a professional in a healthcare system, I hope you'll carry this back to people who may want to hear about this. Part of Act on Alzheimer's work has been to educate healthcare practitioners, physicians, often very reluctant to give a diagnosis, right? So if you go on the Act on Alzheimer's website, you'll find all the tools on the website, including those for provider practice. And one that's my most favorite is Terry Barclay, he's a neuropsychologist with Health Partners. He's modeling what it's like to humanely relay the diagnosis of Alzheimer's to a patient. And so there are a number of practice tools like that that really help physicians and their staff members have tools for stepping out the assessment and the diagnosis, and then really being there to support the person with dementia and their family caregiver. We've also trained a number of care coordinators. So we've trained more than 400 healthcare professionals across the state, physicians, nurses, and then care coordinators in clinics. We've had a lot of really great support from the Minnesota Medical Association, and they've provided a number of webinars, and those are all recorded, and those are all continue to be available. So we've also been able to offer continuing medical education credit. So this is really serious work. We've found that Health Partners, Essentia, Alina, and other healthcare organizations have adopted some of these best practices in dementia care, and that work continues to spread. So that is important work for Act on Alzheimer's, and it really needs to be there, because if we have so much happening at the community level, but people can't get support from their healthcare system, we've only got half of the solution. All right. So we have some opportunities as well as our Medicare program. Our federal Medicare program has changed, and Medicare a few years ago put payment stream in the works so that healthcare organizations, physicians could actually do a physical exam, and it would be paid for by Medicare. And part of that includes a checkup from the neck up, meaning that any person who is new to Medicare or their annual exam should be offered and would have the right to choose to take a very simple cognitive screen that will help them establish a baseline for their cognitive function. And if there were any issues indicated, they could then pursue additional assessment within their clinic setting. So this has really been something that's a major shift across our country in terms of Medicare becoming a program that's more about catching people early, finding ways to offer preventive care across a whole number of diseases, but this is really excellent news for older adults in our country relative to their cognitive health. As I said, the Department of Health has been a good learning partner. They've been able to put much of the curriculums, I should say, that we've developed on their learning system, their state learning system. And that has been, again, a really fabulous way to disseminate this work so that it doesn't just get done and then lost. So that's really all I have to say today about the history of Act on Alzheimer's. And Emily, my colleague from MAAA, will join me now, and she will get to the kind of the heart and the meat of what I know you wanted to hear today. So Emily, and I'll bet you won't stumble at the
I'll remember the clicker, so thank you so much. So as Don had mentioned, one of the goal areas, in addition to the healthcare practice change, is what we call community engagement. And what I want to share with you is what a dementia-friendly community looks like. And I left one of these handouts at each of your spot, and this is really just a visual at a glance of what a dementia-friendly community looks like. And if you'll see, there are multiple community sectors that are represented here. The goal is for all community sectors to work together in order to create a dementia-friendly community. And you'll note there's a little icon there that says Dementia Friends. This is a program that I will be sharing some information with you, because we have several dementia-friendly communities that in addition have these Dementia Friends within them. So I want to share with you next, what are some of those steps that a community can take to become dementia-friendly? And one of those opportunities is through using the Act on Alzheimer's Dementia Friendly Communities Toolkit. Now, this toolkit is divided into 4 phases or parts, and each phase provides steps that really guide a community through a specific activity. So in phase one, key community leaders come together and form an action team. Now this action team is comprised of these community sectors that I had shown you on this infographic, as well as people living with dementia and family caregivers. In phase two, volunteers conduct in-person interviews to assess the community's knowledge about the disease, local resources, gaps, as well as strengths then within a community. In phase three, you then analyze the results of what you've heard, and you put together a plan of action based on these findings in this particular phase. And then in phase four, you look at all of your findings, you create a report, you bring this report of your findings back to the community at large, and this is where it gets really fun, because you engage your community to let them know what you've learned about your community. But the next step then is having your community members help you prioritize your actions that you want to take moving forward, and have them then become engaged and assist you then in identifying and working on these actions, which, and in my 6 years of doing this, all of the actions vary by community because each community is so very unique. So here for you is a visual of the communities that are underway in Minnesota. Over the past 6 years, 40 communities have received grants from Act on Alzheimer's to follow the toolkit and community engagement process. So this map represents those 40 communities, and as Don said, the majority of these communities are continued active. A few no longer convene, but otherwise still active. And I want to share with you that while grant funding no longer exists, we have about 25 to 27 new communities throughout the state of Minnesota that are taking this community engagement effort on by either using the toolkit or working towards some kind of dementia-friendly action within their community. So that gives us a total now of about 65 communities throughout the state of Minnesota that are recognizing the importance of dementia, preparing their communities for dementia, and offering up these actions to support community members. So what are some of these things that are what people are doing? So in the city of Arlington, they worked with their local garden club to create a dementia-friendly community garden. We have several communities that recognized an unmet need that they did not have any family caregiver support groups, so have created caregiver support groups there. Lots of training being done with the retail and government employees, and what that training entails is simply recognizing what dementia is and how to communicate with community members or consumers who are living with the disease. We have several communities that are moving forward with creating a memory cafe. One of those that is just recently opening up is in Hopkins. And then several communities across the state that are creating dementia-friendly choirs, and that's based on a model, the Giving Voice Chorus out of Minneapolis, that has developed a toolkit. So we have lots of tools for people to use in order to begin to take these steps to become dementia-friendly. Additionally, lots of communities hold movie screenings on a dementia-related film, followed by an expert panel that really gets community members out and talking about dementia. Several have published community resource guides, and the unique thing about the guides and the booklets that have been put together is that they distribute them at unique locations. So it could be your local library, it could be the theater, it could be the food shelf, it could be retail businesses. They're thinking outside the box of not just keeping these in a community-based organization, but getting them out to the community at large. Several have held media campaigns, so doing ads in the newspaper, billboards, PSAs. That's an example from the newspaper up in Duluth, from Dementia Friendly Duluth. And then several have identified special relationships with local libraries and law enforcement. These particular sectors seem to be very receptive to working together to better serve the community members that they encounter that are living with dementia. And then also several of them offer the Dementia Friends program, which I'm going to share with you next. So the toolkit and community engagement process is just one step a community can take to work to become dementia friendly, but the reality is that not every community is prepared and willing and has the resources to take on the toolkit. So another opportunity is by offering Dementia Friends. So Dementia Friends is really a social action movement out of the United Kingdom that is seeking the way to change the way we think, act, and talk about dementia. What it is, it's an information session. You learn a little bit about dementia, effective communication strategies, and as a result of your learnings, you commit to making one small action as you. So as me, as Emily, if I'm in this information session, I need to commit to doing something that's dementia friendly. So maybe I visit my grandma with Alzheimer's disease, or maybe I volunteer at a local respite program, or maybe I simply cook with a neighbor who's living with the disease. But it's all unique, and it's spurring people to take one small action. That's it. That's all you have to do as a dementia friend. And so last year we signed an agreement with the United Kingdom to offer Dementia Friends, and we are the first state to offer this program. And that's really exciting. Once we joined the UK, we also became part of the Global Dementia Friends Network, and you can see by those icons on the global map there where their locations are of the other countries that are working on Dementia Friends, and there are 14 million Dementia Friends globally. And we are so very proud to be part of that effort. So here in Minnesota, Dementia Friends is being implemented throughout the state. You'll see the increase in the locations of where we have Dementia Friends in over a year, and the number continues to expand. Last of my checking on my tally, we are definitely the land of at least 10,000 Dementia Friends, which was my personal goal to try to accomplish by the end of last year, and we've made it just barely. And as of this morning, or last time I checked, we're at 11,042 Dementia Friends. And just want to share with you a little bit more about Dementia Friends. We've received some grant funding to do some cultural adaptations of Dementia Friends, to be able to ensure that this program is relevant to a wide variety of cultural communities. So last year we piloted with the African American, Hispanic, and West African groups and have adapted the materials accordingly. And then this year we're working with the Hmong and American Indian communities. In addition, we're using Dementia Friends to create a dementia-friendly generation of youth. We've worked with your neighbors in Shakopee to deliver the Dementia Friends information session to senior high students, and are modifying that information session accordingly so that it is relevant for the youth population. I was part of that pilot, and I can tell you I was moved and inspired to be part of an opportunity to educate young people in dementia, but then also hear their actions and have an understanding then of how relevant this is to young people, and it impacts them as well as impacting us as adults. In addition to that, we had a wonderful opportunity to work with a 14-year-old Girl Scout who, as a result of her participation in Dementia Friends, has written a children's book, Grandpa and Lucy, and you can purchase that on Amazon. But she was so inspired by becoming a dementia friend that she went ahead and wrote that book. So the toolkit, Dementia Friends, great things you can do to work to become dementia friendly. There's easy steps any one of us can take, and that's to increase awareness in our community. You could simply work with the Alzheimer's Association to educate the public on the 10 signs of Alzheimer's disease. You could form a work group to create a community resource brochure. Lots of success in communities with holding community events related to providing educational presentations on a wide variety of topics for people living with dementia and their family caregivers, as well as making a decision to take a sector-specific approach, such as working with the faith community or retail businesses. And if you want to take that sector-specific approach, ACT on Alzheimer's has developed a series of best practice tips and tools for the sectors that are listed on the slide, and you can simply download those and use those as a starting point then for having some communication with those particular sectors that we have tips and best practices for. It really helps to open the door then and increase awareness. And as I mentioned, the libraries have been just a phenomenal group to work with, so very receptive to becoming dementia friendly. And I want to just give you some specific examples of what libraries across Minnesota have done. Several have purchased books for people living with dementia, family caregivers, and youth, and then they display them during November, which is National Family Caregivers Month, and also National Alzheimer's Disease Awareness Month. We have some communities that have created these take-home resource bags, and it's one for family caregivers and one for people living with dementia. And it includes books, DVDs, meditation resources, activities, and they're very, very popular in a wide variety of libraries across the state. We also have communities that offer a one-person bookmobile, so they'll go to an assisted living and read and, provide some Alzheimer's disease-related books there. Libraries are all great host site for that educational programming that I had mentioned, if you want to go that route. And then again, we have lots of library staff that have been trained and participated in the Dementia Friends session. So those are, so any of the actions that I shared with you can really assist a community in working to become dementia friendly. Your first step would be to engage community partners to see where you can find champions and others that are interested in this effort. And I would encourage you in your beginning efforts to always include people living with dementia and Alzheimer's disease, as well as their family caregivers. And also keep in mind as you move forward that your partner is also us, the Metropolitan Area Agency on Aging, and we would be happy to assist you with any of your efforts moving forward. So thank you, and we'll take any questions you might have.
Thank you.
You must have one question.
So those communities that you've identified already, were those community-based, grassroots, or where's their origin? Were there faith-based groups, city groups like
questions.
us? Where do they come?
Yep, so out of the communities that we've been working with, we have several that are geographic in nature. We also have had faith communities as well, and cultural communities that have come together. So an example would be the Twin Cities Jewish community is one of our dementia-friendly communities. Another one is the St. Paul African American Faith Community. A third is the Central Tyrone Carter Act Collaborative. They really expanded their name beyond just their organization name. So yes, it can be anything like that.
It was a great presentation, by the way, very thorough and very clear. You mentioned that besides libraries, law enforcement has also done a tremendous job.
Yes.
What are some examples that law enforcement is doing to be either dementia friends or dementia friendly?
Yeah, so they actually, Dementia Friends, they have attended information sessions and then brought that learning back then to their fellow law enforcement and then just extended the education then of what they've learned to them. We've also seen an increase in programs like Project Lifesaver, and then just increasing conversations about what other mechanisms or opportunities there are out there to keep people living with dementia safe and in their own homes. So it sort of has started in one area and then led to another, and by working with the community and the resources that the community action team has, they're able to supplement any other additional learnings that those particular sectors might have. It's really just getting in the door first,
Yes.
and then seeing where it goes and being open to that.
Right. I would just add on just a bit there that at the national level, at one time, the National Police Chiefs Association was engaged in this, in thinking about this and providing some support for local police officials. And so what we found in our work in Minnesota, as that work has now spread across the nation in an initiative called Dementia Friendly America, that there are some national organizations that are sector specific that have been active in this space, but I think the work that's been different now, both at the national level and here in the state, is that it's getting connected across the community, and then there's a grassroots bubble up.
I mean, I understand that currently the Chaska Police Department is considering, or they put into practice, the use of an app that would enable them to communicate with people on the autism spectrum.
Yes.
So,
Yes.
That could be one avenue where they could also work with people who are afflicted with Alzheimer's or
Yes.
dementia. But another question that I had, Don, and perhaps Emily too, is that the toolkit idea is really great. I think that is something that any community could use as maybe as a template. But you mentioned that you can support and partner with different cities. Just what is the process in that? I mean, what is the role as far as the process goes?
Right, we really think about it as technical assistance, so we can sit down with a group of people who are interested in learning more, and we can do a little deeper dive into what that community engagement process looks like, and then how to use the tool itself. We can help you think about what a kickoff meeting might look like, or who you might want to have there. Part of the community process is that the methodology is that the volunteer members of the community action team go out and they interview specific sectors. So there are sector-specific interviews. Part of that is to really understand where this issue is on the radar of, say, your legal and banking community, or your law enforcement community, or your library systems, and learn what they know about the issue, learn about their interest in the issue, and encourage them to participate in a broader community initiative. That action alone just disseminates awareness and increases interest. And so what we can do is provide some technical assistance support, almost like planning support, to help the community group really find its way through the process. I wanted to say, too, that a tremendous partner in this work has been the Alzheimer's Association, the Minnesota North Dakota chapter here, and they often can be tapped to come in and provide more in-depth education about the disease itself. And they are just always ready to do that.
So I'm really excited to hear that you were working with students at the high school.
Yes.
And I'd love to hear more about that. Like, how are they saying that they want to be involved? And I think that would be a great partnership to be a cross-generational thing, so.
It is, and it's just our beginning steps in developing this pilot, and it really does come down to engaging the superintendent, the principal, you know, finally to the educators themselves, but it does fit in nicely to the opportunities that students need to do for their community work, as well as it can be integrated into health as well. So there are multiple angles to bring dementia education.
It's not just like a club that's doing it.
It's not just a club.
It can be in the curriculum somehow.
And two, doesn't have to be in the school system. It can be in a confirmation class, it can be in Girl Scouts, it can be any of those opportunities where you have groups of young people that are looking to do some kind of community work.
I think that's great.
One thing I was surprised when you were describing kind of some of the issues is you mentioned that physicians seem to be hesitant to provide this diagnosis, and that was very surprising to me, that you're having to provide counseling or guidance and coaching on how to, what's driving that, and what are we doing to overcome that? Because if you don't have the diagnosis, you don't get services.
Right.
So I'm just trying to figure out what is going on there. What can we do to help that situation?
Right, so I think when we think about physician training, it's about cure, right? And we know there's no cure for these diseases, for Alzheimer's or dementia. And so it's just very counter to the way physicians are trained. Also, there's a long history of physicians receiving very little training on Alzheimer's and other dementias. And, you know, we think that we see perhaps that will change a bit, but there's still so much work to do. So it's just very difficult for a physician who's oriented towards cure, and there's not a cure. Would you add anything?
And I would say also, just to add some additional information there, is that there are many instruments out there to screen and to assess patients that have cognitive impairment. And that what Act on Alzheimer's has done through our engaging a series of experts is identifying what are those best practice tools. And we've developed an algorithm then for providers to follow that give you the best screening tools, what you should be using, what you should be using to assess, and then best practices in treating and managing the disease. So that these practice tools that we've developed then also have corresponding tutorial videos, as well as we have an in-person training that's been delivered, which was represented on the slide there. But keep in mind, this has been a very long process. We've been at this for several years, but making good progress.
Good progress, and some really dedicated physicians who have volunteered a tremendous amount of time to putting the tools together and to identifying the best practices and testing them.
And another piece of it too is just on a patient level, advocating for a screen.
Okay.
If you have any sort of inclination that something might not be right for you or a family member.
Okay.
I would say too that the diagnosis and assessment and delivery of that diagnosis is one step, but then part of the best practice here is that physicians then have become aware of community resources. So whether it's caregiver respite or caregiver consultation or creative activities or just helping a patient think about the need for financial planning. And so really it's to be very comprehensive and holistic in helping physicians and other healthcare providers come along that continuum of thinking about the community resources that are really so key to people with Alzheimer's and other dementias and their families. And again, tremendous leadership from a number of healthcare leaders in this community as well as in other parts of the state.
Thank you.
Thank you for your recognition of the impact of this disease on caregivers.
Yes.
I have a mom with Alzheimer's right now, and before that I got to see my grandmother take care of my grandfather and the toll it took on her.
Yes.
Are you aware in our community, do we have any support services, adult day centers for people in our community? Is there anything that you're aware of?
In Chaska?
Yeah, you know, right off the top of my head, I don't want to misspeak, but one of the services of the Area Agency on Aging is the Senior Linkage Line. So if you call the 800 Senior Linkage Line number, we would be able then to advise of all of those kinds of supports. I would be almost certain there would be caregiver consultation, other services such as adult day services or respite services. Likely available either in Chaska or nearby. But the Senior Linkage Line is one avenue to get that information. We have a whole cadre of social workers and other professionals who, that's what they do all day long. We talked to 90,000 people in 2017 about issues of aging and searching for services. The Alzheimer's Association also very expert in helping to provide information about services and supports and more information about dementia itself. They are just a fabulous organization as well. They have a 24/7 hotline, so we know that caregivers sometimes they're looking for information at 1 in the morning and they'd like to talk to somebody, and so that's where they just can really just shine.
Well done, and Emily, thank you so
Yes,
much.
thank you for having us.
You're welcome.
Fantastic, really, really great. Thank you.
Wonderful. Thank
Good
you.
luck to you in your efforts. I hope we can assist you moving forward.
We'll be in touch.
All right,
Yeah.
great, thank you.
Thank you.
Thank you. Okay.
Oh, yes.
Um,
All right.
Well, I guess we'll move on to welcoming everybody, but especially welcoming Kaylee and Sarah, who we have not had at meetings before. Do you want to introduce yourself and just tell us a little about yourself?
Okay, I'm Kaylee Haga. I have lived in Chaska for about 6 years. Work for the state of Minnesota as a legislative coordinator, so I spend most of my time in the Capitol, which is fun or not fun depending on the day. I have three sons who are all in Eastern Carver County schools, 6th grader, a 3rd grader, and a kindergartner. And my husband works for the city of Crystal, so glad to be here.
Glad you're here.
I'm Sarah Carlson. I'm a Chaska resident of, I think maybe 16 years now. For the past 11 and a half years, I've run the Blessed Bee Thrift Store, and have just recently merged our operation into the Random Acts of Kindness Resource Center here serving Carver County. I'm also chairperson of the Carver County Community Development Agency, active with League of Women Voters. I'm sure I have a few more interests, but welcome. Thanks for welcoming me.
Well, we're glad you're here tonight. Thanks. Should we just say our names quickly so that Sarah meets us? Do you want to start, Lisa?
Lisa.
And have everybody say their names, so
Oh,
you
I'm
would.
Sarah.
Name flags here too.
Oh, yeah, I just
knows
thought since she
who we
came in
are.
after we called roll, then maybe she would just like to know who's here, so. Do you want to just say your first name? Lisa?
White. Yeah, it's like Jane.
Hi, Sarah, I'm Robert.
I'm Jen.
I'm Judy.
I'm Donzel Leggett, good to see you.
Nice to see you.
Jeff Philippek.
And I'm Nate.
You should too.
So, one of the things I heard after the last meeting was how wonderful it would be if we could have the minutes from the previous meeting soon after that meeting, so that we could look at what kind of homework we were talking about at the last meeting and stuff. And so I talked to Nate, and he said he could start getting them out fairly soon after our meetings. And I think that's been really helpful. Thank you, Nate.
Yeah, I'll speed up the turnaround for you guys, so not a problem.
And then we
Back to
also have an
desired.
ulterior motive that we talked about.
Yes.
If we get them ahead of time,
That's my
then
trade-off.
everybody can read them when they're at home or wherever. And then we don't have to take 15 minutes to look through them while we're here at the meeting. So hopefully everyone's had a chance to read through them, and if you have something that you want to bring up, whether it's a question or a change or whatever, you can talk about that now.
I have just one. It says on this River City Days that Barbara and I had agreed to assist Lisa on the booth, and I'm happy to do that, but I thought I volunteered to help review the literature and maybe make changes in our pamphlets and kind of update things.
Well, Jen and I looked over what we had and all the boxes down there and stuff.
Well,
It does need
can
some
we just
updating,
talk
but-
about the River City Days stuff when we get to that later in the agenda? But as far as what you agreed to volunteer for, do you want to change that?
Well, I don't need to. I didn't know that I had volunteered, but I will now.
Okay, well, we can take you off
No,
if you
you can
want.
leave
Okay,
Okay.
any other questions or concerns? Okay, then I guess we need a motion to approve the minutes from the February 22nd meeting.
I make a motion.
Second?
All in favor?
Aye.
Opposed? All right, we have approved the minutes from the last meeting. And that brings us to our treasurer's report with Nate.
Yes, so we have no new expenditures from the last meeting to report. Last meeting, we talked about a $100 membership to the League of Minnesota Human Rights Commission. And there were a number of questions that you all identified for me to follow up on. Have not been able to connect with them in the interim. However, you know, I do have questions here in the minutes that we identified, and you know, based on the conversation that I had the first time around, I do have answers to those, and maybe I wasn't clear enough, or you know, I can kind of revisit those things and see if that helps clarify for you. So one of them was, do they meet? The answer to that, based on the conversation I had the first time around, is that They do meet. The problem has been in the past that they haven't been able to consistently meet. They've had a hard time getting their board together, is my understanding. So now they do have a board, and they are trying to reestablish that regular meeting time. However, I think this leads into one of these other questions: how are the current and future board members chosen? Their desire is to have board members from, their membership community, the community members. However, right now their board is made up of folks that are, have been selected and are associated with the director of this group. And I think that the desire is for that to be an interim situation, but when I did talk to him, that he didn't have a clear timeline as to how long that interim situation would last.
When you say the community, do you mean like people from different human
Right,
rights
yeah, so
commissions?
I think the desire would be, for example, if we were to be a member, for someone from this group to then be or at least approach them to see if they would want to be a member of this board as well. So kind of a liaison type situation. I think that's the desire. However, right now, they haven't achieved that goal. Are they trying to develop their board? So that's kind of part of the answer I just gave. What happened to membership, or what happened that membership has declined, and what is the vision forward to rebuild it? The declining membership, what I gathered from my discussion with him the first time is that there was a combination of maybe waning interest and also just lack of leadership for this group that resulted in just, I don't know, it just kind of fell apart. Groups disintegrate sometimes, and I think that's what happened in this case. And so their vision to rebuild, I guess that's part of the effort of, the new leadership coming on board and trying to reestablish a board. So they're just really early on in that effort at this point in time, is what I gathered from what he was discussing. So, I think, like I mentioned last time, that the level of detail that he was able to share wasn't high, and that may be because they're early in their efforts. It's kind of hard to say, I suppose, but I guess I would offer it up if you all, feel like you want me to go ahead with paying that $100 membership. I could do that. If you want to delay and offer up maybe some additional time to contact them, we can do that. Or if you decide that, based on the information I provided last meeting and now, you're ready to make a decision, I'll leave that to you.
Is the membership based on a calendar year?
Yes, yep. So we receive an invoice annually for $100 membership. That is one consistent thing that they've been able to provide.
I think one of the things to really consider is what Donzel had brought up last time, that since it's membership based, if we and other commissions aren't paying the dues, is it gonna just fall apart? Or, is our $100 gonna help get them back on their feet and move them forward?
Would anyone be interested in serving on it? I mean, because it sounds like they're looking for people, right?
They are. It's not a requirement of membership, but they are looking for folks
I
to
think
do
when
that.
Barb Colhap gave us a summary of this organization at the last meeting, basically she said that it was, when it was doing well, there were a couple of people from each of the city human rights commissions that were on this, participating in these meetings, and that that's probably what's fallen off. So my view would be, if we're going to pay it, we probably should have someone check it out or join that group if someone's willing to do it. Because it sounds like they had a pretty good vision, and from what Barb said, they did good work before it fell apart. So.
When I could also speak to that, as I mentioned the last time, the idea is a good one, but as a group, they've been in this suspension and rebuilding process for the last few years, and it's evident right now they can't really have a structure of what their group is about or which direction that they want to go, it seems like. And I don't think our $100 is going to make or break than me in any sense of the word. So, I mean, if somebody is interested in connecting with them and attending their meetings and coming back with updates, that might be a suggestion. Otherwise, we could just move on.
I think it's prudent to say, what would we get for $100? I can speak, can't I, as an alternate?
You can speak, yes, it's the
Okay.
voting.
Right, I won't vote, I
Yeah.
promise.
Yeah,
But I mean, what would that $100 give us? And if, it doesn't seem to me like we're getting anything in response, although at one point in time, it was an active organization, at one point in time, there was good feedback. Sometimes paths change. And so it seems to me like maybe we would have $100 more in the budget to spend someplace else if we didn't pursue.
Yeah, I think so. And we could also revisit this again next year. Maybe at that time, they may have a different structure, different way of doing things, or more focused program where they want to go.
And if they are in fact rebuilding right
They
now.
bill us every year, right?
yes.
That they do. We get an invoice every year, but not a whole lot of other substance behind that, so.
We had a similar conversation last year.
Yeah.
Around this.
Maybe we could, once they get a little more organized and they can articulate their mission a little bit more, maybe we just invite them here sometime in the fall and.
Yeah, give them some time to get their feet under them and come and talk to us.
Yeah, my vote is if we're not, if someone here is gonna be part of the group, we shouldn't pay it. Because they're not gonna rebuild unless people from committees like us, or like ours, commissions, join. So, I mean, it's just kind of one of those things, it'll be a self-defeating, self-fulfilling prophecy. So I'd say if no one can, I can't honor at the time, I would do it, but if no one can, then I think we just don't pay it. That'd be my vote.
I move to go ahead and take a vote of whether we're going to pay this invoice or not. And
So I think you may want to pick a side and make a motion about which direction you think you'd like to go to allow that vote.
I would move to not pay the invoice for this year for the League of Minnesota Cities, $100.
Okay, all in favor of not paying the $100?
There should be a second.
Oh, sorry.
Yeah.
Second?
I can't second any.
You can.
Yeah, you're Barbara tonight.
I thought you seen them
I can't make a second.
Yep, so we've got.
I don't know how it
Just to remind the
Because
group.
I'm alternate number 2, so I thought when
Okay,
alternate
well,
number 1
at the-
came, then
yeah,
I won't.
Barbara is absent tonight, so, with you being here at the start of the meeting, Sarah was a little bit late. We established you as a voting member, so Sarah is not a voting member tonight, as a result of that, so. So
Okay.
if you do want a
I
second,
will
you can,
second
but
that.
anyone can second.
Okay, so Lisa seconded. So all in favor of not paying the $100 and looking at it again next
Can
year?
we just phrase that as not re-upping our membership in the Minnesota Human Rights Commission? Because the not paying the invoice thing is a little,
Just not
Yeah.
not renewing our
Yes.
membership this year.
Yeah, not renewing our membership. All in favor of not renewing our membership, say aye.
Aye.
Opposed? Okay, we will not renew our membership in 2018.
And before we go any further, I know we adopted the agenda before the visitor presentation, but they gave a very thorough presentation. There was a lot to think about and discuss. I think it would be a good idea for us to take at least a few minutes today to discuss possible next steps if we were interested in pursuing and making this as part of our initiative going forward.
That could be a topic to bring up in the other business, if you want to.
Yeah.
So,
That'd be my preference.
yeah, if you could at least reserve at least a few minutes for that.
We can put some of this other stuff off, maybe, like River City Days, we have plenty of time. We could table that till next time, too,
Okay.
if we're
Well, that
worried
sounds-
about time, because it's already,
Okay.
So do we want to
it's not my call.
wait on River City Days till next month to talk about that?
Okay.
Anyone have anything pressing?
I would just say keep going down the agenda and things that we're not ready to talk about, we'll.
Okay,
say we're not ready to
okay.
talk about, 'cause that's probably not the only one.
All right, so then we'll move on to unfinished business. Or Nate, do you want to tell us our total for money right now?
Yep, so we start the year out with $2,000 and we haven't had any expenditures, so we remain at $2,000.
All right,
Thank you.
it's good news.
We need a motion for the
I got
treasurer's
it.
report too, or?
We haven't historically done that, but, yeah.
Okay, we're gonna move on to unfinished business, and last month we talked a little bit about the secretary for this commission. Typically Nate has been the secretary and taken great minutes for us, but we heard that Kaylee may be interested in something like that, and you weren't here, so we decided to wait to discuss it till you were here. So are you interested in the secretary position?
I take notes, so I'm happy to do it if it's one less thing for Nate to have to do, but it's not, I could go either way.
Okay,
So sure.
okay. So when we discussed it a short time last month, what Nate had told us is that sometimes it makes sense for him to be the secretary because we're involved in the discussion and the process. And yes, we do ask Nate lots of questions, but as the commission members, then sometimes it makes more sense, you know, to not be distracted by that. But if it's something you're very comfortable with, then, you know, that wouldn't be an issue.
I'm very comfortable with it. I will say that you guys are very blessed because Nate provides much more in-depth minutes than is standard for most board meetings.
He does a
And
great
I
job.
can't promise that I will go into that level of detail because my training is to be a little bit more higher level. So that's completely your call. But I take notes for myself. I think the conversation was that I take lots of notes, and I would take notes no matter what.
Oh, okay.
And if that's helpful, great. But if we would rather have Nate continue to do it, that's fine as well. Or I can send him my stuff at the end if it helps him fill in the blanks.
Compare notes.
There you go.
I really don't have much to say about this, other than I will continue to do it if you want me to, and if someone else has an interest as a commission member, you know, certainly I'm not gonna, it's really up to you all, how you want to proceed here, so.
So does someone nominate someone then? Is that the next?
Do you want to be nominated, Kaylee? That's kind of what I'm.
Sure.
I nominate Kaylee Haga to be secretary. I would like to make a motion for a vote.
I second.
Okay, so we're gonna take a vote. All in favor of Kaylee Haga as the secretary of the Chaska Human Rights Commission, say aye.
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 Opposed? Okay, Kaylee, you're now our secretary.
Pressure's on now.
Right.
Congratulations.
Thanks.
We like the level of.
I'll finish
detail
out the
that
notes
you-
on this meeting, it's fine.
You can be the substitute too. If Kaylee can't make it, well, then we'll let you fill in, because we know you do good.
It's really up to you all, so no need to apologize.
Okay, so,
Just be sure to turn them around quick.
I will.
Yeah.
oh yeah, because this commission wants things done quickly. So now we're gonna talk a little bit about some of the initiatives that we touched on last month. One of the main things is, we talked about having like a theme overarching for the year, And a couple of different things were brought up, homelessness and hunger. But we didn't necessarily decide on which one we're gonna do, or if we're even gonna do a theme for this year. So I think we
Well,
need to.
actually, Jen, what we discussed, I mean, when we brainstormed in January, we had some ideas that were presented. And the theme, tying things together, was one of those ideas. So it wasn't necessarily homelessness or hunger as a theme, but that was one of the initiatives that was presented as an idea for something that we can take on this year. That was my understanding.
Okay, my understanding was we were talking about a theme for the year, so
Right.
each of our events that we do would somehow tie to that theme.
To whatever the theme is, but
Right, but we
didn't talk
haven't really
about whether
picked-
homelessness or hunger or anything else to be the theme.
I
Well,
think those were examples
yeah,
given
they were
during the meeting,
examples
but I
and-
agree that I'm not sure that it was decided that we were going to use those.
Yeah, and I guess I'm still trying to wrap my head around this theme idea. I don't know what value that would add to having a theme for all of our activities in the year.
Yeah, the value that it adds by having a theme is kind of like when you build a strategy for a year. Your strategy goes against a certain objective that you want to make the biggest impact you can. So if you have a strategy or a theme and it's to make an impact on a certain area, you put all your activities aimed at that theme so you can make a bigger impact. But if you have, it's kind of like if you have 5 fingers, they say you put all of them together and it's more force. But if they're all going in different directions, you don't have the same power. So it's like you can do a lot of different things and you don't have to link them together, but the ability to have as powerful an impact on one area is lost. So it's a choice that we can make, is do we want to have a broad approach that's not focused, or do we want to have an approach that touches many different areas, but is focused around a theme so we can make a bigger impact since we're a small group and our funds are limited. So that's really what the choice is. So there is a value choice. It all comes down to what do we prefer. Is it more of a broad approach, many different things in a small way, or trying to do certain things, but try to focus them to make as big an impact as you can? That's really why you decide on a theme or strategic intent.
I mean, I see what you're saying, Donzo, but what I'm saying is that rather than trying to shoehorn, let's say, one initiative to another and somehow tie it together. I mean, if it naturally goes together, that's fine, but besides us, how is that going to impact the people who attend, the people who we engage with, the people that we partner with? And because we are looking at several different topics, for example, with this aging, Alzheimer's, dementia-friendly community, rather than trying to tie everything together, because there's a variety of issues that is of interest and importance to a variety of different people. And sure, if holistically they do go together, then, we could somehow tie it, whether in a promotion or in an advertising campaign. But it seems to me to just to do it for the sake of doing it is a little bit arbitrary.
I guess I'd like to hear from you, Donzo, on how you would connect, say, the issue of homelessness with River City Days and the powwow. And those are items that we've talked about already doing. No decision has been made, but can you just explain that to me a little better so I can understand it?
So one opportunity could be, as we think about working, and I haven't talked to the lady from the powwow, so I can't answer that. But with River City Days, let's say we have a booth. The last year we've had a booth, it was basically, there was really no plan on what to do with that booth. This year, we said that homelessness was important to us. We would make sure that not only was our booth more visible, we would have literature that's geared toward educating people on homelessness, preventing homelessness. We can invite people to the booth that are experts on eradicating homelessness in the area. And we can, even, have some other things that are, more geared to, again, raising awareness around homelessness at the booth. So we're there, we're present, which we were last year, but this time it's targeted to making sure we're raising awareness. At the powwow, I'd have to think more about that because I don't know as much about how the powwows work. But typically at those kind of events, again, if we're there as a Human Rights Commission, we're there to help support the powwow. But we can also talk about the fact that we've got, again, maybe a station there that's educating people on homelessness issues, specifically around Native Americans, which that is an issue specifically off the reservation. So those are ways you can tie it together. So you're still doing two different things. One is a powwow celebrating Native American history and culture. The other one is River City Days, where they're helping. But what we're talking about, the literature we have, what we're trying to push is educating people on homelessness and that type of thing. So that's how you would link them together, would be one idea.
And in light of the discussion tonight, dementia-friendly communities would possibly be part of the housing,
Yes,
a housing umbrella kind of theme that could be included.
absolutely.
So homelessness isn't necessarily the term we would want to use for the theme, but housing in general might be able to be an umbrella over all of those things.
As could hunger.
Right.
If I say that in January you did discuss hunger, you could have the various organizations that are helping and trying to meet the needs of those in our community that don't have sufficient food. So, I mean, again, you could tie that all together.
Yes.
I'm a participant at River City Days, and so I always make sure that I visit all the booths. And I think you're absolutely right. You can have a presence there, and people will just walk by your table. But you can have a presence and something that folks can really, oh yeah, that's a good idea. I could do something like that. And you get more participation from your community.
And then like in the MLK presentation,
Yes.
have a speaker maybe on
Yes.
homelessness in communities of color or in general, or,
Yes,
okay.
yes. So again, it's a different thing. You're celebrating the legacy of Dr. King, but while doing that, you're raising the awareness of the HRC and on the homelessness issue. You could have a speaker talk about homelessness. You could even try to do a fundraiser is tied into that, and those funds will go directly to a homeless shelter or something along those lines. So it's just finding a way to magnify the impact versus having it be small impact on many different things, bigger impact on one thing that we can make a difference on. I think that was the thought.
Okay.
So I guess we need to decide if we want to have a theme for the year for our initiatives. And then if we do, then we have to decide what it's gonna be. So.
Were there other ideas kicked around? I couldn't see that in the minutes. For a theme from January?
From the February meeting, or,
I'm sorry. Is that what I'm looking at?
yeah,
Okay,
Yeah.
from the February meeting?
I think this was a discussion that we didn't have enough time to get to
Ah.
at the February meeting, and so the January minutes would reflect different ideas for the theme. I don't have those in front of me
I think
right now,
these were the
unfortunately.
two big ones that everyone kind of, it's like, we can do this year, one or the other.
because there were broad topics that
Yeah,
could.
well, and yeah, say we do homelessness this year, maybe next year the theme is hunger, but we'll still have maybe the pamphlets at River City Days for the homelessness or whatever, but yeah, like you can tie it all in together.
I think it makes our job easier because you know what you're gearing into instead of trying to divide that by 10 different
Well, and it's not excluding anything, it's just a focus. It's not that we don't still do
Right.
Right,
equal rights or anything like that.
right.
But I think just to make it easy, we just maybe this year pick one of these two since it's already March. And
Yes.
then, and next year, maybe people will have more ideas for different things.
So, do we take a vote on this? Do we make a motion about it?
You know, I think
would need a
homelessness and hunger were presented, I presented those as separate events, but of the two, I mean, if that's what we're considering, it seems to me that hunger or food insecurity may affect a larger population, and there are a variety of ways that we can get involved more with hunger issue and homelessness. I mean, not saying that we don't work on homelessness. I think that's something that we should and can do. But because hunger is such a identifiable, widespread issue, even in today's economy, maybe that's something that we could focus on this year in a variety of ways.
One thing I keep thinking about is when Bob Repke and Corey Megstedt came and spoke to us about the housing, the affordable housing and transitional housing project that is tabled and will be coming up again this year. And we talked about how was the Human Rights Commission gonna kind of be involved with that or have a relationship to that whole thing? Because we didn't really know much about it before when it came up. And so I kind of feel like the homelessness or housing issue is a very timely thing because it's coming up this year again that they're revisiting that kind of project.
You know, and I think the hunger one is a great one. It'd be nice if we could pick it in January and then maybe get like even kids at the school involved with their capstone projects and doing food drives for events that we have and stuff. And it's already March now. It's like everything's kind of done with that. But if we started that like next year in January, then we would have the whole year and maybe get students involved or.
Even kick that off with the Martin Luther King thing in January.
Yeah. Yeah,
And
whereas.
January is typically a tough time for a lot of like food banks and stuff because after
Well,
the
we have a food
holidays,
drive at the
people are.
MLK breakfast.
Yeah,
Drops off. Yes, that's right, that's right.
yeah.
So if we do homelessness, you know, the rest of the 10 months year, and then we have 12 months for hunger next year.
Yeah, it's a great idea.
I would advocate for housing, like a broader umbrella, because I think that gives us more opportunities to find
Yeah.
places. But, you know, The Economist just came out and said that Minneapolis is the third most expensive city in the country, and that is in large part because of the lack of affordable housing.
That's exactly true.
And that's an issue here. I know it's an issue within this community. I mean, look at the rental rates around here. So I think that there are different pieces we could touch with different segments of the community.
With affordable housing and homelessness. And there's less public support. I mean, there's, at least there are food banks, and, you know, there's, again, we're trying to get another transitional shelter, or at least one. It's just, there's not a lot of places, not a lot of public help. But as an aside, Bob and Corey are wanting to get back on our agenda next month, if that's possible. If we can add them to come back to update us on the status of that transitional shelter, what they can do to help. Before I forget, he just reminded me that was something they asked me to do.
So like during the guest presentation like tonight?
No, for next meeting, maybe
Yeah.
we can invite them, bring it up then.
But bring it
Got
up like they had, like we
Thank
had the
you.
guest presentation
Yep,
tonight?
glad that.
So, Madam Chair, can I even make a motion?
I don't think that you can, unfortunately.
Okay, never
as a
mind.
voting member. Yeah.
I will make a motion
Make a
that
motion.
we take a vote to make affordable housing our focus item for 2018. Housing, to make housing our focus item for 2018.
Is there a second?
Second.
All right, all in favor of making housing our theme for 2018, say aye.
Aye.
Opposed? Okay, we have a theme for 2018, and I think it will give us kind of something to focus on as we're doing all of these projects throughout the year.
I think there's a next step too, and so we need to coalesce that together in some sort of marketing plan, because I think we've had the discussion here tonight, but how do we articulate that to the community is the
Yeah,
next big step. So
Great idea.
I think we should talk about that at our next meeting, so we can keep moving right now. And then we can also talk about a point person that maybe can make sure that all the things are working together. I think right now we should move on, and Donzel, if you have any updates on the powwow, if you just want to do that.
I do not have an update, except that, like Jeff, I realized that well, my wife realized for me that I'm not in town that weekend either. But I will still continue to be the point. If it comes down to they need physical presence that weekend, then I'll have to let the commission know. But I just wanted to make sure that that was clear as well, that I'm not in town that weekend, and I didn't know that. I will maintain being the point, and I will again let the commission know if physically being present there that during the powwow is an issue and we need support.
Okay, but you haven't talked to
No.
Kate or anything?
No,
Okay.
I've not.
I am not going to be in town either at that May date that they suggested.
Yeah.
Okay.
That impacts our,
And Jeff won't be in town?
son's getting married.
Oh, that's right.
oh, the little thing like that.
And I also found out that is prom weekend, and my daughter's a senior in high school, and so is Lisa's, so we probably will not be available that weekend.
Okay, I will give her a call and just let her know the situation. We can
Okay.
do a lot to help up until that point,
Sure.
but in terms of physical presence there, that would be
Yeah,
a problem.
just tell her there's a lot of us that have things going on. Yeah.
Okay.
Yeah, but please offer whatever we can do to push it, social media, marketing, whatever we
Yeah.
can help with that way, we offer that for sure.
And my recollection was that wasn't a firm date either, that was one she wanted, so maybe if it's another date, we can do more.
Okay, I'll find out. I'll follow up.
Thank you. For River City Days, Lisa and I met to go down to the basement to get the literature out of the basement to kind of go through.
I wasn't with you, not in the
Well,
Saturdays.
but you said that.
I saw the stuff we talked about, just maybe really quick, we talked about maybe updating some of the flyers, taking, some of the flyers had like names, the members' names on it. And we thought maybe to take that off since there might be changes, and if we want to have a separate notepad or whatever, or handout that they can get our names and contact info, maybe getting some bling, buying some bracelets, you know. Let's see, what did I found one where you can get like 300 for like $50-some. Can have Chaska Human Rights Commission printed on them, or candy, something to draw people in a little bit.
If you'd like, we have a staff person who sort of, for whatever reason, that's become one of her tasks, is to obtain these sorts of giveaways for stuff like this. And so, you know, she could help with making that purchase. If you can identify, I think, you know, if you could identify the thing you want, and, you know, then I can let me know, and I can connect you with her, and she can help make that purchase.
I don't think we
that'd
have
be
to
great.
decide that tonight by any means. I mean,
No, I mean, that was just my little 2-minute spiel, and we can talk more about it next time because we have plenty of time.
And then, I want to just write down who does want to help with kind of the little planning committee for River City. You had mentioned that you wanted to kind of look at that literature
This is,
and go through it.
yeah, I will not be here at the next meeting, and I'm not positive I'll be here for May's meeting either, but I will be back by June 1st.
Okay.
So I'm happy to help any time after that, but I'll be out of the country, so I won't really even be available by phone too well.
Okay.
So with that said, if you don't need help before June 1st, I would be happy to help. If you do, then perhaps somebody else would be better.
Well, I don't know exactly what we need to do yet. I did have a question for Robert. We found lots of different literature down there, and we were wondering if you know where it came from or how we could maybe get.
Which ones?
Well, there were some things that were just like general human rights pamphlets, that we only had like a couple of those, or, I mean, I have them all here, we can go through them later and I could show you, but I was just wondering, like, if we want to order different things, where we go to find where we get more of them.
Well, a lot of the pamphlets that has to do with the Minnesota statute
Okay.
and what are your rights in the Human Rights Statute and those kind of things were from the Minnesota Department of Human Rights.
Okay.
You could go down there. I went down there last year and the year before that, and they have a lot of pamphlets that they give away to different city commissions.
Okay.
So they may be updated, they may not be. The statute hasn't changed very much, but their materials may be different. I don't know.
The other
Your
question we
contact.
had is, do you know if they were available in different languages?
I think we had some in Spanish.
Yeah, there were a couple of pamphlets
Yeah,
that
yeah,
I had looked at
yeah,
that were in Spanish.
And they could be available in other language.
Because we were just thinking that might, that might be good to have some different languages available for the different people at River City Days or whatever event we're having, so.
Yeah, they're very cooperative and very supportive with things like that at the state.
Do you call
state
ahead,
level.
tell them you're coming, or?
You can, or, yeah, there's,
Yeah,
I'd be happy to take care of that if you want pamphlets in different, I mean, I work with those folks pretty closely, so,
oh, nice.
yeah.
Okay,
yeah. And they're, like I said, they're very helpful with those kinds of things. So that's one resource you could do. Other items, pens, I mean, whatever.
I looked into
That
other
kind of
bling,
thing,
like
that's
little
fine.
bubble
Yeah.
things that can have our name printed on them and little
well, one thing we
frisbees.
had talked about is maybe having like a game or something, to kind of just get people to come in. And it can be very, low tech. I came up with the idea when I was talking to Lisa that we could do like a fishing pond where we just cut out like paper dolls in all different colors, and put paper clips on them. They fish for it with a magnet. And then depending on what their little person says, they get bubbles, or they get a bracelet, or a sticker, or whatever. I mean, it doesn't have to be a huge, costly thing.
Yeah.
Um,
One thing that, just for you all to consider, I know our Parks Department does have they've got a trailer for block parties, and within that trailer are all sorts of different games. They're not gonna be human rights related or anything, but they're just, small little yard games that kids may wanna play. And so we could approach them and ask whether one of those things could be made available for this tent. If you're just looking for an activity, that might be one way to tap into something that already exists.
Well, something to draw people in to make our booth a little different than just that row of booths that are all along there.
Well, Lisa, since this is kind of your thing for River City Days, do you want to connect with the Parks Board people or what, to find out what they even have?
Okay.
Yeah, just go to the
You'll
office at
help
the
me.
community center. Yeah, I can help you.
Okay.
And then, Robert, is there any updates about the Cultural Heritage Festival?
Well, the planning process has been underway. And this year, we're building up on what we did last year. So the time may increase and the groups may increase as well. So, we got some great feedback from last year, from the attendees from last year. So it's ongoing.
So do you just want to keep us posted if there's anything that planning group needs help from the commission or anything?
Sure.
Okay. Do we want to do an update on the MLK breakfast, or?
60 seconds, real quick,
Okay.
I think. So it'll be the second annual. The chamber would like to be involved again with the Human Rights Commission as kind of a co-sponsor. We do have the Martin Luther King holiday, which is January 21st, I believe. And Nate, we already got the Chaska Event Center reserved for that, so we're good to go there. Last meeting, we did talk about the Human Rights Award being presented at this event. So at some point, we'll have to start searching for nominees and going through that process. But and then the agenda, I know we want to keep youth involved. We'll invite the Diversity Club back. I think we'll get after music earlier. I think I'll reach out to the high school teachers in the spring here, just to let them know so they're ready right away in September, so January. And then I will have to look for a keynote kind of centered around our theme. I think will be the last piece there. So we're a ways away, but some of the preliminary work's being worked on.
It's not so far off, even though it seems like it right now. Okay, thank you. I think we'll move on to other business. And I know that, Robert, you wanted to have a little discussion
Sure, yeah,
about.
Yeah, I think it makes sense to at least take a few minutes today to talk about metro aging and Alzheimer's and Alzheimer's-friendly communities and, what our goal, if anything, might be relevant to this topic. I mean, one thing seems clear to me that, the need is there. It's within our purview as a Human Rights Commission. The population that is affected includes people who are dealing with Alzheimer's and dementia, as well as caregivers and their families and friends. So it's a wide-ranging issue. And it also deals with things like inclusiveness and equity. Some members within our community are not being included their full potential within our cities. So, looking at it from that standpoint, I think that is well within our purview. And secondly, I did invite them with the potential that we take action on this. Research is fine. They have a great website if you want to learn more about it, but I think that, when we invite presentations and visitors, that is an eye towards some action steps that we may want to take on an issue. So the action steps with regards to Alzheimer's is, do we want Chaska to be designated as an Alzheimer-friendly community? And if so, there are certain things that we can do. They even have a toolkit. I don't know how closely that cities really follow those 4 steps. I'm sure that depending on the community, we can adjust certain things to fit our needs and our desires and our outcomes. But I think that if we can move towards Chaska becoming a designated Alzheimer-friendly community, that would be one goal. The goal, I suppose, as relevant to this topic.
It's a big one to wrap your arms around. I mean,
Yeah, there's a lot of moving components, that's for sure, right?
Yeah.
I mean, we have to engage with a variety and multiple levels of partners,
right.
as well as the population at large, as well as local and county government. So, yeah, it's a big task, I
Yeah.
think. But
Would you suggest maybe having a committee that is working on that and reporting back to, or are you suggesting all of us?
I think we're the committee here, Judy.
The subcommittee.
A subcommittee is what she meant.
I think we are, well, the subcommittee, and that, I mean, we are a 7-member group with 2 alternates. I don't know how much smaller that we want to break it down to.
I think the concern with that is that we just talked about some pretty major things that we're gonna be working on this year. And for all of us to also add a whole new initiative is a lot, to kind of take on in a year where I don't know that I would be able to give it the attention I think it deserves.
Well, why don't we just go ahead and take a vote on it? I mean, if it's something, rather than, I don't know which major initiatives are we talking about besides powwow, you mean, or the River City Days booth?
I think all of them, I mean, I know there's subcommittees for each of those things, but we've already talked about how even though there's point people for them, we're still, as a commission, gonna be involved in them. So those are 3 pretty major events that are coming
3?
up.
How do you get 3?
The powwow, the River City Days, and the Martin Luther King breakfast.
Well, the powwow, I don't know, depending on what Domzo comes back with next month, it seems like Martin's and the other persons are taking the lead. I don't know what more involvement would be necessary from us, except for the promotions and putting it on the websites. And for the River City Days, as we mentioned, that's been taken on by the River City Days board as far as the planning, logistics, the performances, the groups, a lot of the funding. And the booth is a booth.
An option might be, Madam Chair, is that we could go to this www.actonalz.org and take a look at some of their community-wide dementia-friendly tools, and certainly have those available at the booth that you're talking about for River City Days as part of the, these are kinds of things that, and you might build support there for folks saying, yeah, that, I want to help designate Chaska as a dementia-friendly community.
That's a great
See what kind of
recommendation.
interest there is in something
I mean,
like
because they
that.
already seemingly have those tools
Right.
readily available.
And also, I think it's an opportunity to recruit dementia friends. And I think that's a good first step to get people to get into the mindset of converting the whole city to dementia friendly, which I think is a great idea, and I 100% support it. I'm just not sure if, again, with the resources we have, being all volunteers, if we can take all that on. But I love the idea of, we could, again, that's something that would fit in, because, again, I heard that people are afraid to be diagnosed. There's probably people that are facing housing issues because because they're in this situation. So I think it does fit in terms of sharing the information at River City Days, recruiting dementia friends. I think that's good. The other thing I think we have to be cautious of is, again, we were asking Bob and Corey to come back, and we said that we were going to try to figure out a way to support building awareness on the transitional shelter. And we don't know what that's going to entail. And so I agree, powwow may not be that much work. River City Days may or may not, I don't know. But I do think, you know, that's something we've been in conversation with them since, what, 6-8 months. And we need to hear back what the status of it is. And that's why I'd be a little cautious of taking on a...
Well, I've been in conversations with Corey about that too. And, you know, we did talk about the homelessness and the shelter group. Building community awareness is a key for them. And that's something that we can come alongside and work towards in the fall, homeless in my hometown too. So that's to be discussed further with Bob and Corey. But, you know, to be clear with this dementia-friendly community, then just so that we are clear, you know, I would move to take on the issue of Chaska becoming a dementia-friendly community and taking steps towards that.
I think it's a great idea. I would love to see Chaska become that, but I also see that it is going to involve representatives from a number of different areas,
Very
including our
collaborative.
police, our Chamber of Commerce, business owners.
Senior living centers.
Yeah, medical facilities. And
Retail
it's going to take a lot of time. I really don't see that accomplished in a year. And so unless people are really willing to work on it outside of our hour-and-a-half meeting time,
But that's always been the
and
case.
that's why I suggested a committee, like a subcommittee working on gathering other team members that would be interested in developing that, and then kind of coming up with a plan that the rest of the commission could
I think the
assist with.
presentation was great. I think we don't have enough information to make a decision about whether to move forward. One of the things she said that I noticed was that there used to be grant funding available for this.
Right.
There is no longer grant funding available for it. So I'm curious about what those 20 or so cities who are engaging in the communities that are engaging in this are doing in terms of generating funding to support this kind of work. The other thing is that Chan is a dementia-friendly city, and so I would be happy, maybe Nate can help me to connect with whomever is running that over in Chan to see what that looks like from their perspective, so that we can have a little bit more idea of what that process is,
What it
because it was a
took to get
great
them there. What it took.
presentation, but we don't have any idea what the mechanics of
Well,
that
and
are.
one thing they did say too, a couple of different times, was this took a lot of time and a lot of work.
Yes.
And so I feel like if I'm gonna take a lot of time and a lot of work on something, I wanna do a really good job of it. I think it's a super important project. And I think by checking with Chanhassen, who's our neighbor, that could give us a lot of insight, because in many ways we're similar, and they're nearby and easily accessible to talk to about it. And so I think maybe it isn't the night to vote on anything.
Well, the motion is still out there, so.
What is the motion? Is the motion that for this commission to work on it, or you're personally saying you'd work on it? I'm
No,
just
the motion is for this commission to take on this as an initiative this year, beginning now.
So Robert made the motion to take the dementia-friendly community on as an initiative for 2018.
Yes.
Is there a second?
Well, I think I can second that. It just depends on what it looks like, because I agree it's not going to get done in a year. So involving the community stakeholders, I think it's probably going to be a process to become declared a city. And I don't want to leave it behind, because homeless and hunger breaks our hearts, but Alzheimer's is gonna be, the aging of the population is gonna be even worse and more costly than anything that we're seeing right now, so I don't wanna leave it alone.
I
So I
guess I
support
would
us
feel
being
more
on it, but I
comfortable
just.
having more information, like maybe from Chan, about actually what
What
it
does it entail?
entails.
Right.
Yeah, my
Looking at the
intention was not to
toolkit.
leave it behind, but to
Right.
wait a month and
Yeah,
see.
just get more information.
So the reason I guess I'm seconding is that let's take that next step. We're not saying that a year from now we want to be
But the
declared.
motion was to make it an initiative
Oh,
for
okay.
this year.
Versus, I mean, I could make a counter motion, because I love the idea of Kaylee doing additional research. And I also love the idea of at River City Days, because I think it is a first step to start recruiting or educating people on what dementia friends are. And I think that is a first step, and it's a good one. I'd certainly be willing to do that. But to commit to kind of taking it on as an initiative, I mean, that sounds like a lot more, that I'm not educated enough to say what that entails.
That's fine. I mean, that is the motion on the table. And as far as having pamphlets, handouts at the booth, that's always possible. I mean, that's not difficult to print out pamphlets from the website and engage people in conversation. But I'm talking about a different concrete goal.
Okay, so
That's
we have a
to make a
motion
Chaska.
and a second to vote on if this is an initiative for 2018. So all in favor, say aye.
Aye.
All opposed?
Oh,
Nay. But I'm not opposed to doing it, I'm just opposed to
Just to
doing
making
it
it the
today.
initiative.
I'm opposed, but I'd like to make a counter motion for, I don't know if I can make a two-point
That's out of
motion.
order. I think
but
she's
it's
gotta
for-
roll on the
for
motion
Kaylee
first.
to,
Wait, yeah, we need to rule on the motion first.
I voted no. I said then I'm making the counter motion.
So, yeah, I think first,
Two-
Jen needs to make a determination as to whether the motion on the table carried.
Oh, okay.
So you can make that. I'm also going to offer that this work can go forward without any vote occurring.
Okay.
Oh,
So, I think I've heard pretty clear from Kaylee, sorry,
okay.
that she's willing to go forward and work with Chanhassen and learn some more information. I know staff at Chanhassen I can connect you with. I know staff at Public Health, Carver County Public Health as well, and I know that they were involved in the effort at Chanhassen. So I can connect you with those folks, and you can learn more and bring it back to the next meeting. All that can occur without a motion happening.
And perhaps, Robert, you could look at the toolkit and kind of send out maybe a memo summarizing what that whole toolkit involves before the next meeting that we could look at too.
Well, I mean, it's all available on the website. You could go and take a look at it. But the reason why I made the motion is to, I mean, it seems pretty clear. I mean, yes, it's going to be time consuming and it's going to be difficult, but, we're not here to do just the easy things like a booth or games. I mean, everything does take a step-by-step process. And this is the type of things that in past years we've tackled and brought on. So it's a doable thing. It's something that if we put our minds and heart to it, it's an achievable goal.
well, I think we should
So-
revisit it after Kaylee has talked to the Chanhassen and gotten some feedback, because I think we could talk about this for hours.
Yeah,
tonight.
I'm going to suggest, I'm hearing general agreement that moving forward, if, Robert and Kaylee, if you want to team up or however you want to do that, and learning more about this, I'm not hearing that there's general sentiment against the idea. I think I'm hearing that there's more effort needed to learn more and maybe figure out a plan forward. So I think all that can occur. I'm not hearing that there's any dissent for that right now.
Okay. So we'll leave that topic till next month when we hear some follow-up on it.
So there was no, so we had a motion, a second, and vote, so that's, so
Well, there were 2 people that voted yes, and the rest, the majority was
Okay.
no.
But Nate, what you're
So-
saying, that's
and
not
then
even
Nate said we
necessary for the
didn't need
record
to
now,
have the
right?
vote.
Because we've just come to consensus on something else, right?
Yeah, I think general group consensus in this situation is
Yeah.
fine, to proceed with, looking and gathering more information. Yeah. So, yeah.
Okay. Is there any other, one thing, I want to bring this one question. In the past, we have gotten business cards for the new commissioners. And if you're interested in having a Human Rights Commission business card,
Just shoot
then,
me an email and I'll get it
then
done
let
for you.
Nate know, and
Yep.
he can get that ordered for you.
Yep.
Okay. That's done. I'm done with that. Is there other business?
Yes, I'd like
I
to
have
make
some too.
a statement, if I can, read a
Okay,
statement.
we'll let Donzel go, and then you can, Judy.
It'll be brief. So I want to let you all know that I've decided to run for the Minnesota State House seat in Senate District 47B. And I was endorsed by the DFL as the candidate at the March 10th Senate District Convention. I am aware this commission is a nonpartisan and non-political group, and I am committing to this commission that my campaign will have no impact on my actions with the commission, nor will there be any conflicts of interest involving my service on the commission and my campaign.
I mean, first of all, thank you for running, Donzel. But I would ask Nate to, just so that, we are clear and we don't encounter any issues leading up to the election. If Nate could look into any precedents or any potential areas of conflict or
I can look into it further, but I can say, we've had members of the Planning Commission run for council seats. We've had members of this commission run for other elected positions in the past. And so it's not something that folks, that's unheard of and can't be accomplished. So I think, like Donzel stated, the statement that he put together reflects his intent pretty well. And I don't see an issue right now, but I could spend a little more time to make sure that we don't find something I'm not aware of right now.
Yeah, I just want to be proactive in that.
Thank you for being part of our democratic process.
Appreciate it.
Okay, thank you, Donzel.
That's it.
Judy?
Well, I guess I had a question. I was doing some thinking over the month and trying to think of what things that I would be interested in and on this commission and or what I hope that the commission could accomplish. And so I thought of a couple things, and then to that end, I also looked up other commissions in other cities and kind of see what they were doing. And so I guess first of all, my question would be, when you have ideas, would you like them to be submitted in an email before the meeting or just discussed during open business? And I can be really fast, but.
So my recommendation would be, either would be fine. If you've got an idea that you want to talk about and think should have a place on the agenda, it's probably best to submit it to Jen or me, and we can, discuss whether we should put it on the official agenda, or if it's not on the official agenda, this is what, the open, or whatever we call this, the other business section of the agenda is for. And so this is an opportunity to bring up thoughts or ideas, just as we've been doing so far. So either way would be appropriate.
All right. Well, my thought was that I would just kind of throw a few things out there. If there seemed to be any interest, I would look into them further and come better prepared with information. But if you're not interested in doing them, then I won't. But the one thing that that I was thinking about was, you know, with all the DACA things and the citizenship. And I know, Donzel, that your family was aware of a woman that recently was granted citizenship.
Yes.
And I don't know if there's a way to find out who in our community it is, but I think that that is something that should be celebrated or at least acknowledged by the commission, that we have new citizens in our community. I think it's an important thing in people's lives, and I think it would be nice to be able to congratulate them or acknowledge that accomplishment. I looked at Eden Prairie's, Eden Prairie has they have their commission, and then they have the Bias Crime Network, which is a collaborative effort between the Eden Prairie Police Department and their Human Rights Commission. And it was set up, I'm just gonna read it off of their website. It was set up as a support network for citizens who feel they have been discriminated against or have been victims of bias crimes. When an incident is reported to the police, the commission is notified. Names are usually anonymous and takes action. And I was kind of thinking, I wonder if we could do something like that, at least as a information gathering thing. So we, as a commission, would know what kind, if there are bias crimes going on in our community and what they are, if we could work with our police department to set up some kind of
Isn't there a link on the Human Rights Commission website to something about bias crimes or something? There's like the nominations for the award, and then there was another link that I think was for
So,
something
yeah,
like
we
that.
have a link right now that leads to the Minnesota State Department of human rights. They have, domain over that in statute. This is a commission that hasn't really been assigned that sort of responsibility as far as how to handle those things or making decisions on those things. I think the council's preference is that the group work more on the idea of educating the public and opening up dialogues about issues and things like that. I think for this commission to go down that road would require the council, giving that directive and that authority to do so.
And I'm not even suggesting doing something about it like they are. I'm just saying that would be a way of gaining information of what themes or what issues are facing our community that we could, if we get if there's 10 charges of police brutality on Somali Americans or something like that, then we would know maybe that's an issue we want to talk about or learn more about. I'm not saying that we're going to, like they, providing any services or taking the reports. But as a way of getting the
educating the community,
reports.
educating the council, because they may not be aware.
Yeah.
So, but having the information makes us aware. You're not saying that we go
Right.
provide services, but by having
Exactly.
the information, we would then be informed, and we could inform,
Right.
those who
And
could.
I think
do
it's
something.
our job to be informed
Yes.
about what kind of things. Just something to think about. I don't need to do anything more other than that I would look into it further if people are interested. Bloomington does a monthly e-newsletter of the things that they're on. And then that kind of got me thinking about, I see we have a guest here tonight, but whether we could, I don't know if the city newspaper, the Herald, they have that section with meeting notices and stuff on there. If they charge you to put your meeting notice there, or they do.
In that weekly column, they don't,
I don't think they do, yeah.
yeah,
Or to
and
put
there's
our-
the,
There's a charge for notices.
not for the meetings, we put them in for the church I work at all the time. There's a section called Connect, I think. It's just a little column where you put just whatever your meeting is, and the time and the place. And it doesn't cost anything. I mean, it's not guaranteed to go in there, but if there's room, it goes in for free.
Or maybe publish our agendas on our website a couple weeks before the meeting, so if people want to look at it and say, oh, I want to talk about that, I have input into that and issue, and then they could show up.
I think that's an excellent idea about the website. One of the things I did when I was considering applying for this position is I immediately went to the Human Rights Commission website, and it's in need of an update, clearly.
Yes.
But as I read in the minutes, a new communications person is coming on board for the city, and he or she will be charged with doing those kinds of things. Is that?
We'll be updating, we're actually entering into a process to fully update the city's website probably over the summertime. So, that's gonna have to do with the way that it's organized and the way that it functions, the way that people interface with the homepage. But content on the website is something that we've got different individuals throughout the city who can work on those things. I think for the Human Rights Commission, I can help with that, but I would seek maybe someone, if you're interested in taking that on, suggestions about what you'd like to see on the Human Rights Commission page. But we would need to develop that content and provide it to our communications person to make that change. And we can make content change now. We don't have to wait for the website project to be complete. So.
And Nate, have we ever had I don't know if you know, but have we ever had like a newsletter of some kind that would come out from the HRC, or some sort of a printed update or anything like that, or just the minutes online?
I think, as far as I'm aware, it's really relied on the minutes and the agendas that get posted.
That's good stuff, Judy.
The last thing that I have, and we don't even really need to bring it up now because it's not available until summer, but the University of Minnesota has a equity and diversity certification program that is free, and they have a basic one that's 30 hours, it's 10 sessions, 30 hours, and an advanced one that includes some additional things. I printed off their kind of summary of it, and maybe we can attach it to the minutes or something. If anybody's interested, I did sign up to be notified. They have a new registration system that isn't going to be ready until May. So I did sign up to get notified of when that is, so I can let people know when the summer session is, if anybody's interested in that. But
It's for individuals, or?
Yeah, it's for individuals, and it said it was for students, faculty, or alumni, but then when I put my name in to fill out to be notified, it also said external community members, so I think it's open to anybody.
And it's free?
And it's free.
30 hours?
It's 30 hours.
Wow,
Yeah.
that's impressive. I didn't know that.
Yeah, if you could send that to Nate, I'd like to see it on when he sends out the minutes.
Or is Kaylee sending out the minutes?
Or Kale, I'm
They
sorry.
will send out the minutes regardless.
I can handle it for this meeting.
I don't know.
That's all I have. I just am
Okay.
Good stuff.
always thinking.
Good
So
stuff.
does anyone else have other business, or are we ready to adjourn?
A second.
All right, all in favor of adjourning?
Aye.
Aye.
Opposed?
Oh, there you go. There you go.
Good meeting.